I'm Dr. Freddie Gomez. The Doctor is In is a telemedicine show made for you to ask your medical questions during the time of COVID 19. Today's episode, though, is going to be special. We'll focus on the government's roadmap to address this pandemic ahead of President Rodrigo Duterte's State of the Nation address on Monday. We expect the speech to have many references about the coronavirus. There are many questions we all want answered. So I'd like to welcome, it's my pleasure to welcome on the show Health Spokesperson Undersecretary Dr. Maria Rosario Vergeire. Thank you for joining us on the show, Dr. Vergeire.
Good afternoon, sir, and good afternoon to everybody.
Now, it was on January 30th when we reported the first case of COVID 19 in the country. Where are we now on the fight against this highly infectious disease?
Well, if we are going to map out what we have done no, for these past months, we can say that we were able to prepare our system if and when this continuing rise in cases will persist. So from a once laboratory, we only had one laboratory. We were sending our laboratories then to Australia so that we can get confirmation. Now we already have 91 laboratories. Before, we only had one quarantine facility, and that was in Clark. Now we have almost 8,000 plus quarantine facilities in the local governments, and we have 14 mega facilities in the country. If before our hospitals did not have these COVID referral hospitals, now we have these referral hospitals as well as accepting hospitals. We also have joined the different trials for medicines so that we may be able to have our population access these drugs if and when they need it.
Definitely, a lot has changed since the past several months. But the Philippines has among the longest quarantine restrictions in the world. But over the past several weeks, some areas are experiencing some easing of these quarantine protocols despite the rise in COVID 19 cases. Yusek Vergeire, what's the plan moving forward to contain the virus?
Well, as we all know, and our experts even are saying, and even in experiences around the globe, the experts are saying we cannot remain to be locked down forever. We somehow have to continue on with our lives, open up some of the sectors of society, so that we may be able to have this new normal. And by doing that, we have placed safeguards so that we may be able to have this new normal. First safeguard is everybody has to implement the minimum health standards, and that is something that has to be complied with every by everybody, so that we may ensure that the transmission would not continue and the cases will not rise. So this is one of the things that we are looking at right now, so that we may be able to further the easing out of restrictions in the different areas of the country. Second would be the local government units had been given authority so that they can be able to assess their situation, and then therefore they can implement specific lockdowns in areas in their locality. It doesn't have to be citywide or municipal wide. It can just be barangay or it can just be a street, as long as the local government would be able to assess that it has to be locked down so that they can contain the transmission.
That's right. I think that's very important to have that balance between trying to get people back into businesses and trying to maintain people to stay at home in order to stop the spread of the virus. But with the increasing amount of cases, how are we ensuring that all sectors of society get the medical attention they need?
Well, for these past weeks, we are very busy setting up this one hospital command. This is the framework that we are using so that we will be able to ensure that there would be enough hospital beds for those who might need it in this time of the pandemic. So the secretary already has ordered that all hospitals should have their surge capacity up until 70% of their hospital beds should be dedicated to COVID if we would be needing it. And also, the private sector is helping out as well. They have been mandated that they should be able to provide at least 30% of their hospital beds for COVID.
That's right. And I'd like to focus now on the new normal, a bit of what you mentioned earlier, because our lives have changed so much because of this coronavirus. What can we expect moving forward, Yusek Vergeire? What's the direction that the government is taking to prevent the spread, to prevent the further spread of the coronavirus?
Oh, well, first and foremost, we are focusing now on behavior. Behavior would be the key. Change in behavior would be the key for us to be able to address the situation. We have this campaign, the Be the Solution. It means that each and everybody or each and every individual in the country would be the solution. So B is for bawal lumabas ang walang mask. Uh, i-sanitize ang kamay, D, dumistansya, which is physical distancing, and A is alamin ang tamang impormasyon. You should be educated and informed on what you are supposed to do. So our major strategy for this battling of this pandemic right now is the change of behavior of people. Because if the experts already have given us the recommendations saying that if only we can implement properly these non-pharmaceutical interventions, we will be able to address the situation. We can control the transmission of this virus. But of course, we are supporting it with other things that we had been doing from the very start. That is tracing, testing, isolating, and treating.
That's correct. And as we see economies all over the world are opening up, dito rin naman, we see changes and some easing of restrictions. Let's review, Yusek, what the new normal is like for those who take public transportation every day. What are the safety precautions in place for those that commute on a daily basis?
Well, the safety protocols, no, especially for those individuals commuting every day, would still be the same. It should be coming from them, the individual, that they should be wearing their mask, they should practice the physical distancing, and also they should always have handy, their alcohol so that they can always sanitize their hands. When it comes to the transport system and the agency in charge of that, they had set in place different measures so that they can ensure that people will not be gathering will have this kind of mass gathering, that there are a lot of people. There are stickers on the floor so that they will know where to stand, so that there won't be a crowding of people in this waiting areas for the transport system, as well as inside the transport system. There had been barriers placed, like for example, for those jeepneys and also in buses, they have set these barriers. And of course, there should always be the safety officers that would check if our commuters and as well as our operators of our transport system are following the protocols.
And all those protocols are definitely a welcome to all the commuters. Now, we know that testing plays a key role in responding to the COVID-19 pandemic. When we return, we'll take a closer look at our testing capacity, our targets, and our ability to trace and treat people who have COVID-19. You're watching a special edition of The Doctor's In ahead of Monday's State of the Nation address. You're watching The Doctor is In right here on CNN Philippines. Today is a special episode dedicated to better understand the government's efforts to fight this pandemic. We are joined today by Health Undersecretary and Spokesperson Dr. Maria Rosario Vergeire. Thank you again for joining us here on CNN Philippines, USEC. Now, we know testing is our window into the pandemic, and the more we test, the more we know the overall situation. And even more so, the more we test, the more we can isolate and treat patients. So, nasa na po ba tayo when it comes to testing capacity, Yusek?
Yes, we already have 91 licensed laboratories as of this time that we speak. we already have been able to test around 1.2 million people already. Our average for our testing is already around almost 25,000 tests being done per day. So we have this goal of reaching 1.5 million people being tested by the end of July. And I think we will be able to reach this goal by the end of July, considering that we are already almost 1.3 million in what we had been testing since we started our operations. It has to be understood by people that we started off with our laboratories, as I've said a while ago, we just had one, and now we have 91. We were just producing 300 tests per day when we started out our operations, but now almost 25,000 tests per day. So with this, we were able to expand already our protocol. When in the start of the response, we were just focusing on those with symptoms and those of the vulnerable group, like the elderly, the pregnant women, and those with comorbidities. But right now, we have expanded it even to include those other vulnerable population, other frontliners, which are non-healthcare workers, like those like the PSGs, the BHERTs of the barangays, the local officials as well, and the other high-risk groups. Also, we have included sectors of the working class. No, so we have the cashiers, we have the tellers in the bank, we have the sellers in the market. So they all had been included into this expanded protocol that we have. We also are now have now included other means of testing. We just don't have RT-PCR tests right now. We also have the Gene Expert cartridges that we are using. Also, we are trying out, and hopefully in the coming weeks, we will be able to implement the pooled strategy in testing. So all of these are being done so that we will be able to test more, detect more, and then isolate more so that we can eventually contain the transmission of this disease.
That's definitely great news because the more people we test, the better picture we have on where this virus is spreading and where we should concentrate on. And as you mentioned, there are several strategies in place to increase testing in the country. But one of those is the RT-PCR test kit developed by UP, which are now ready for commercial use. How will this help achieve the target tests per day?
Well, it will help us a lot, no? It will benefit the country because this is a locally produced kits. Currently, as we all know, we are having shortage internationally because all the countries are competing for these supplies in the laboratory. But now that we have these locally produced kits, we will have this stabilized logistics for our laboratories, wherein these local producers can already provide our laboratories with whatever logistical needs that they would be needing for their daily operations. We don't need to compete internationally anymore. And of course, the price, because this is much cheaper than the foreign brands for these RT-PCR testing kits.
Definitely good news. Now, the Philippines is part of the World Health Organization's Solidarity Trial to test the safety and effectiveness of possible therapies in treating COVID 19. And currently, hospitals are using remdesivir, tocilizumab, and convalescent plasma in an experimental state or under compassionate use. Do we see these medications seeing FDA approval anytime soon, or do we see the Department of Health having a standard protocol for therapies to be used for those with COVID 19 symptoms?
Yeah, actually, we already have adopted the guidelines of the Philippine Society for Microbiology and Infectious Diseases, wherein in their guidelines for managing COVID, they already have included these off-label drugs that we are using for the clinical trials, such as the remdesivir, the interferon, also the use of the other drugs that we have in the market, which are off-label. Of course, FDA is looking at and studying it if we can already have this kind of registration for these specific drugs. But before we can do that, we have to finish the clinical trials first and see if really it is effective and it is safe for our general public to use whenever they have COVID. So we have to wait for the results of these trials first.
Now, Dr. Vergeire, everyone is longing for the vaccine for COVID 19. And the Philippines actually is looking at several countries, namely China, Taiwan, and even the US. Now, the US, the United States, is currently in phase three of one of their vaccines. And if everything actually goes well, the reports say that the US will have a viable vaccine by February of 2021. Based on reports, ito yung pinakamaagang nakikita natin possible date for a viable vaccine. Now, if everything goes well, if this is available in the US by that time, when can the Philippines realistically acquire this vaccine if one is available, like I said, in the US by February of 2021?
Well, the country already has started positioning, no, since the time that the news about vaccines being developed were issued. So the DOH is working together with the interagency task force. The agencies in charge for this would be the Department of Science and Technology, and then of course we have DOH, we have FDA, and the other agencies in government, and of course Department of Foreign Affairs. So there had been four manufacturers already, which have signified their intent to help us, and we are currently negotiating with them as to what arrangement we will have, because their vaccines already are in the early phases of the stage 3 trial, and hopefully also these four manufacturers will be able to finish their trials by the first or early part of next year. As to the other vaccines, we also have signified our intent already and has submitted our letter of intent to the WHO so that we can join in this WHO solidarity trial for vaccines. By doing this, we will be able to access no these vaccines that are already as they say no will be available by the first quarter of the next year.
Yeah, definitely some good news. I'm sure marami nang naiinip kasi para dun sa vaccine. Now, before I let you go, Yusek Vergeire, do you have a message for our viewers on how to assure them that continue pa rin ang fight natin against COVID-19?
Yes, thank you very much. Thank you, Doctor, and thank you to all of you. And I'd just like to say this message for the Department of Health. We have to realize right now that every one of us has this responsibility in helping government address this situation. We have to be the solution. So we have to change our behavior so that we can be able to transition into this new normal. It is not so much for us that we have to do these things like wearing of mask, washing our hands, and doing the physical distancing, or even staying at home when there are, you don't need to go out because there are no essential things to do. So let us all help each other, and let us just we need to help each other and the government so that we may be able to address this situation. So thank you again.
Maraming salamat, Health Spokesperson and Undersecretary Dr. Maria Rosario Vergeire. We're taking another break right here on The Doctor is In. This is our special SONA 2020 presentation. We are back on The Doctor is In. Testing, treating, and tracing. That's the 3T strategy in responding to the COVID-19 pandemic. Joining us this time is Dr. Jean Solante. He's the chairman of the Adult Infectious Diseases and Tropical Medicine section at the San Lazaro Hospital. Welcome to the show, Dr. Jean.
Hi, good afternoon, doctor. Good afternoon.
Good to have you here, doctor. Now, given the constant increase in cases, what specific steps should we take to flatten the curve?
Okay, I think we are doing the things that we have to do. Okay, like the quarantine for those who have been exposed to COVID confirmed or COVID probable, and for those who have been positive, they have been isolated, and if they have the symptoms, they have to be treated. And as much as possible, if these are patients that are highly vulnerable, then they have to be in the hospital to be observed and to prevent the complications. The other things that we need to know with regards to flattening the curve is really the physical distancing. And I think one of the most important part of really flattening the curve is doing the contact tracing. Uh, it's highly emphasized that when you do contact tracing, you also emphasize the possibility and more importantly that you look for all the contacts of the COVID confirmed case, whether they are symptomatic and whether they are asymptomatic. The fact that the transmission is driven by most of those who had symptoms, but we cannot totally deny that even if you are asymptomatic, you still have the chance that you can also transmit the virus. So those are the important things that we need to really emphasize. And then I think our health protocol measure should also be in place. I think you've heard a lot that a lot of people now are so complacent in wearing their face mask even in public or even in enclosed space. We have to really emphasize the importance of these health protocols because primarily this is one of the most important protection for an individual not to get the infection. And I think I would not like to preempt the hopefully the vaccine will be coming over, and it's one intervention that we can really decrease the number of cases because for one we need to give the vaccine especially for those who are highly vulnerable so that they can be protected of the infection at the same time prevent the transmission of infection.
I'd like to go back to something you mentioned earlier, Dr. Jean, about contact tracing, because I think a lot of our viewers are still unsure on how this is very effective. This is actually an important tool in trying to fight the spread of the virus. Ano po ba ang mga parameters ng contact tracing? For example, sa isang taong nagka-COVID-19, how does he or she begin to basically retrace his or her steps?
Okay, so the mechanism of contact tracing will start with if you are positive confirmed, then you have to look at how many of your how many of people have you had contact with at least 2 days before the onset of symptoms and until the time that you were isolated. Okay, and then you have to list all of these contact, and then you have to investigate how many of them are asymptomatic and how many of them are symptomatic. You have to prioritize all of those who are symptomatic because once they are symptomatic, then they have to isolate themselves and have themselves tested. Well, for those doesn't have the symptoms yet, even if you don't test them, you still have to advise them that they have to stay home and be quarantined.
Okay, so very clear example there on how contact tracing can be very effective. Now, Dr. Solante, we have questions here from our CNN Philippines Facebook page. We have one from Rex Evangelista. Ang tanong niya, how can we make sure that passengers going back to their provinces are properly tested before they leave? Is rapid testing enough to get travel clearance?
Okay. Now, the you have to think of this. Now, when you're going back to the province, you have to see to it that you are not actively infected, meaning you have the virus, you're carrying the virus. There are two tests. I think you have explained this before that to determine that you have a current active infection, you need an RT-PCR. The other test is the rapid antibody test. Now, the problem with the rapid antibody test can also detect active infection, but timing is very important because an acute infection cannot be detected by an antibody test unless it's already around 7th to 10th day after the exposure or after the symptom. So that's quite tricky because if they do a rapid antibody test and they are negative, then the question then, will you allow them to go to the province or to go back to the province? Maybe yes, if they don't have the symptoms, but they still have to practice physical distancing and wearing a face mask. But if they are IgM antibody positive, then that's they should be isolated and they should be confirmed with an RT-PCR. Now, I think what's good about antibody tests that if it is IgG positive, then they have been exposed and they have recovered. So, granting that that individual doesn't have symptoms and IgG positive, then like high likelihood that he has recovered, he has been exposed, then he can go back to the province.
Okay, Doctor, paano naman kung RT-PCR test ang hiningi sa kanila and hindi nila kaya nito ng bayaran, hindi nila ma-afford? What advice can you give kung ano dapat nilang gawin?
Okay, so ang problema dito kasi ang government natin or yung mga local government, that's what still insist, no, na kailangan RT-PCR negative ka. Ang malaking kasing tanong dyan, if you are RT-PCR negative and you don't have the symptom, then definitely you would be negative with that particular test. No? So I think what's really important there is uh, they have to find a solution like doing a quarantine. Once they will be allowed back to the province, then they have to be quarantined for 14 days and observe for signs and symptoms rather than requiring them of all of the tests. And these tests are not really perfect, that if they are negative, it doesn't mean that they don't have the infection. It's really observing them. Once they arrive in that province, they have to be quarantined, and again they have to be observed for symptoms. Now, if there are no symptoms occurring within that 14 days, no, they don't need to be tested. No, they have to be released from the quarantine after the 14 days. Remember the incubation period after the development of symptom, the period 14 days is the rule. Sometimes you can extend it to 21 days, but strictly speaking, 14 to 21 days more or less safe for us, that if you don't have the symptoms, then you were not, even if you were exposed before, you don't have the infection because you didn't develop the symptoms within 14 to 21 days during quarantine.
Okay, thank you very much, Dr. Jean Solante, for joining us on The Doctor's In and sharing your expertise with our viewers. And that's it for our today's show. We hope we were able to help answer some of your questions. I'm Dr. Freddie Gomez. Stay safe, everyone. And remember, we are all in this together. It's about making choices in our day to day lives that promote the common good.